Have you ever had the experience where you know that there's something going on with your body, but you can't quite figure out what it is? So you go to your doctor, you tell them about it, they order blood work, you go, get that done. And when the results come in and you check with your doctor, everything's normal. And maybe there's something that's a little bit high or a little bit low, but the feedback you get is like, hey, nothing's really going on, you're fine. Western medicine works on the disease model. So if somebody comes in and they tell me that they have this set of symptoms, I find certain things on physical exam, we do blood work or imaging, all of that together paints a picture. And if they meet criteria, then they have disease. If they don't meet that criteria, then they don't have disease. And that works well for certain really acute, severe, in the moment type illnesses, but it doesn't help with chronic health or optimal health or figuring out why aren't you feeling your best. To give an example of this, if we think about our thyroid functioning. So we have this gland in our brain called the pituitary gland, and it will release this thing, TSH, that goes to our thyroid and says, hey, we don't have enough thyroid hormone, let's pick up production. And then your thyroid pumps out more of the thyroid hormone, the brain senses it, and then it doesn't release as much of that TSH. So if you're experiencing hypothyroid symptoms, so like constipation, dry skin, vision changes, hair thinning, falling out a little bit maybe, a lot of sensitivity to the cold, and your TSH is 4.0, then in a traditional model, we wouldn't label that as disease. We would say, you know, nothing's really wrong, but next year when you get your blood work again, let's keep an eye on this and see what direction it's going. A more functional approach would be to look back and see, all right, the last time you got that TSH checked, where was it at? Because if it was at 2.7 last time, and now it's at 4.0, that could show a pattern. I like to look at it from a house metaphor perspective. So if we have our normal lab ranges for thyroid, 0.5 might be the basement. And then the first floor, maybe like 1.5 to 2, the second floor, 3, the attic might be more in the like 4.5, 5 range. You are going to feel much differently if you're on the first floor or the basement than you would if you were in the attic or sitting on the roof. And that's going to have impacts on how you feel physically and mentally that can change your quality of life in your day-to-day.
As a doctor or a patient, it is incredibly important to understand where the normal reference range comes from. For TSH, that normal reference range of 0.5 to 5.0 means that 95% of the people in the group that was tested had TSH levels that fall in that range. 2.5% were higher, 2.5% were lower. But that group was not screened for a goiter, which is swelling in the thyroid gland in the neck, thyroid antibodies, a family history of thyroid disorders, if they were on certain medications that might influence that. They didn't check in terms of their iodine levels and intake. There were so many factors that aren't taken into account. So this group, the National Academy of Clinical Biochemistry, did that. And they found that when those things were accounted for and those people were not included in the sample, that 95% of normal drops to 0.5 to 2.5. That means that anybody above that 2.5 range could have some amount of risk for hypothyroidism symptoms and developing potentially hypothyroidism in the future.
So if you get your blood results and you talk to your primary care or whoever ordered them for you, ask them, okay, if it's not abnormal and if I don't have a certain disease necessarily, what would you recommend as the optimal range? And what can I do to get closer to that? I hope you found this helpful and feel better prepared the next time that you talk to your doctor about your lab results or re-explore some of the results you had before. If you have any questions or comments, drop that below, and I hope you have an awesome week.
Serotonin, dopamine, the mind is more than can be seen. It's intricate, not just a mix of chemicals you need to fix. Listening